I'm Dr. Rajesh Ravindranathan, popularly known as Dr. Raj. I'm here to speak to you about neuromuscular dentistry and how it helps solve temporomandibular joint disorders and obstructive sleep apnea. I've finished my fellowship and mastership from the International College of Craniomandibular Orthopedics, the only organization where neuromuscular dentists form a huge part. I'm trying to bring that to India so that the lack of awareness about neuromuscular dentistry is wiped away. Obstructive sleep apnea, or OSA, is a silent killer. The problem with OSA is the lack of awareness, especially in our part of the world. We as dentists need to provide the right care for sleep apnea because it's that dangerous. Sleep apnea accounts for 80% of all sleep occurring deaths. That's a horrifying fact from the West. It should be much more in India, but no one even knows what sleep apnea is. Diagnosis of OSA is very important. It all depends on the symptoms that the patient suffers from. Again, there's a myriad of symptoms that the patient could have. Things as simple as snoring or disturbed sleep to much more complicated stuff like feeling breathless while climbing stairs, blood pressure issues, etc. Ideally, there is a stop-bang questionnaire that we ask all the patients to fill up. If just 3 of those questions are answered in the positive, that means there is a high chance that the patient is suffering from obstructive sleep apnea. Once that is done, we ask the patient to undergo the lateral ceph X-ray, a sleep study, and, if possible, volumetric analysis with a CBCT. Now, what's a sleep study? A sleep study is wherein your actual sleep pattern is being recorded over one night. You can have it over a couple of nights. What we look for, the parameters are the AHI, the snoring, and the desaturations. Why does OSA occur? And how can a dentist who practices sleep medicine help you? The reason is because the position of your lower jaw is closely related to the airway space that you end up when you sleep. Now, what happens when you sleep? All your muscles go to rest, including the muscles that control the position of your lower jaw. For some people, the lower jaw drops even more further backwards than others. And since the tongue is attached to the lower jaw, the tongue falls back as well. This creates a pressure in the airway. The airway is a pipe through which we inhale oxygen. The oxygen goes to the lungs, to the heart supplies it all over the body, and the assimilated carbon dioxide is pushed out to the same air pipe. When the tongue forms a block in the airway, the oxygen isn't going to the heart. So the heart isn't getting as much. It needs to work double time. Over the years, the heart, which is a muscle, gets tired. And which is why some people, when they climb a flight of stairs, they end up with breathlessness. That's one of the symptoms. Next, if this oxygen is not going to the cells, at one point of time, there is an accumulation of carbon dioxide, and the oxygen concentration within the human body comes to less than 97%. Now, that is known as a desaturation event. The body is not going to accept that. Come on, you've got more carbon dioxide in your body than you're supposed to. So what does the body do? The brain, it's like a switch in there. It detects this, it tells your tongue, go forward. As it moves forward, it pulls the lower jaw along with it, and you clench. Hence, every time you're in normal sleep, you try to go into deep sleep, the sleep is broken because of this event. Which is why if people say, I sleep well, I sleep for 8 hours a day, but how good is the quality? If 25% of your sleep is not deep sleep, it's carried over to the next day, which is the next symptom. What happens? You're tired the whole day. So what does a neuromuscular dentist do? How can he help you get rid of this dangerous problem? We use the TENS device to relax the muscles and a couple of sophisticated machinery like the K7 or the BioPack, and we find out where exactly the jaw has to be in a forward position. We register the bite and we give you an orthotic, an oral appliance. The oral appliance ensures that the lower jaw is kept in a forward position even when you're sleeping. This stops the lower jaw from dropping back. Hence, it stops the tongue from dropping back. Hence, the airway is always patent. The heart gets enough oxygen. Over time, it's a strong muscle again. You stop feeling breathless. The cells are well repaired. The carbon dioxide goes out. There's no more waking up, no disturbed sleep because there is no desaturation event. No more clenching, and you don't feel tired the whole day. It's a life-changing device. It's as simple as that. So, how do we treat the dreaded sleep apnea? There are two ways to do this normally. The path that was always followed was by using the CPAP device. Now, what does the CPAP device do? It's a ventilator-like machine that, with the help of a mask, it pushes in oxygen through the airway and the mouth and pushes the tongue forward. These machines help when the AHI is above 15. Again, a parameter that we follow from the sleep study. With the advent of oral devices, what happens is you don't need to wear a CPAP device. Why? Because the problem with the CPAP is it's expensive and it's very difficult to be with. It's non-compliant, which is where the oral appliances score. Snoring. You can stop snoring. Isn't that a big blessing in disguise? Yes, it is. Why do you snore? So when the tongue falls back, it hits the small tongue, also known as the uvula, and you make the noise. When you wear this device, the jaw pulls the tongue forward and the tongue doesn't hit the uvula anymore. So you don't snore anymore. So, in short, if you snore, if you feel breathless, wham! It's a high possibility that you are suffering from sleep apnea. Please visit the nearest dentist who knows about neuromuscular dentistry and who can help you with sleep apnea. Do not wait for it, because if you do, you're waiting for huge trouble. So folks, for further details, log on to tmjindia.com and take an appointment at the earliest date.